Guys, welcome back to Medical Coding with Blue. It's Answer Monday. The countdown days I'm going to tack on to Q&A Tuesday tomorrow. Sorry about that. Let's go ahead and get started with the answers, and then I'll talk about what happened today at the end. All right, so let's get started. Number 1 was the left wrist ganglion cyst, right? With the injection into the ganglion cyst, I got for the diagnosis M67.432, and then I got 20612 with the RT modifier, okay, for the right side. Number 2 is aspiration pneumonia due to food regurgitation. I got J69.0. Number 3, parrot fever. I know. I got, for the diagnosis, I got A70. If you're like me, you have to look up what is parrot fever. So it's a contagious disease among birds. It's caused by chlamydia among birds or whatever. And it's transmitted to humans as a form of pneumonia. So it is mostly from parrots. That's why they call it parrot fever. But it is a bird illness, right, that gets passed to humans. So like I said, it's very serious and I shouldn't be dancing to it, but parrot fever. Okay, next one. Number 4, the right and the left carpal tunnel. I got G56.03, and then the right carpal tunnel injection, I got 20526 with the RT modifier. Now, I know that it is just the right side that was injected, but whenever you have a patient that has a bilateral condition and like they receive service for one side, you would still use the bilateral code. This is why you would put the laterality modifier on there if it applies, and in this case it does. So you would do that. I just thought I would throw that one on there because I think I threw some folks off last time about that because they were asking me, well, if they're only treating one side, why wouldn't we use the unilateral side? You're always going to use the side that is most specific to that patient. So like I said, if they have it bilaterally, you're going to use the bilateral code, okay? All right, number 5 is the left primary osteoarthritis of the shoulder. I got M19.012, and then for the steroid injection into the acromoclavicular joint, I got 20605 with the LT modifier. Now, why did I get 20605? Because you're thinking, oh, it's in the shoulder. No, the injection was into the AC, or the acromoclavicular joint. So the AC or AC joint. So the AC joint is considered a medium joint. This is where you have to kind of look at those details. This was a mistake that I made in the beginning because I saw automatically was the shoulder. That's all I saw. But no, there's 2 different areas. So you have to watch out for that. This is why I'm trying to do these ones where you can catch these little detail things. So this way it'll kind of help you to kind of train yourself and to get a sharper eye and make sure that when you are looking at these things, that you're watching for those details. And if you're not really sure about the size of the joints, just take a look in your anatomy section in your ICD-10 book. They have plates, the anatomy plates, like the different illustrations and colored pictures to show you what areas are what. So if you're not sure if a particular joint is a medium or small or large joint, then you make sure to look that up. Okay. All right. Number 6, the migraine, refractory migraine. I got G43.809. And then for the bilateral Botox injection, I got 64615. And that's it. There is no modifier on this because according to the description of that code, it says that it is injection bilaterally. So you would not use a modifier. If it's telling you that it is a bilateral code, you're generally not going to use a 50 modifier on those. Okay, if it says that the procedure code happens to say that it is unilateral, then you can use right or left, or those kinds of modifiers. But when it specifically states in the description of that code that it is a bilateral procedure, then you wouldn't use a 50 modifier for those. That's another thing to watch out for. So whenever you are looking to see what modifier to use, see if the code is already telling you. Okay, is it telling you, like this one, for example, it says it's for the bilateral injections. So this one is telling you that you don't have to use a 50 modifier. Okay. Number 7 is acute appendicitis, K35.80. The laparoscopic appendectomy is 44970. Okay. Now, number 8. Now, I know that we did not have a full note, okay, but I want to get you guys thinking about these things. So when you start hearing key words, and I'm going to point them out here in a second, this way you can start to capture those in your mind and think, okay, now I got to make sure that I look for this, or I got to look for this. So the question was for the bilateral knee osteoarthritis on a patient who's morbidly obese with a BMI of 45. For the diagnosis, I got M17.0, and then I got E66.01, and then I got Z68.42. Okay, now for the procedure part. Okay, we said a therapeutic injection was performed on the right with ultrasound guidance. The provider documents that due to the patient's increased amount of adipose tissue surrounding the joint, additional time and manipulation was needed to locate the joint to perform the injection. So the procedure code is 20611 because that includes the ultrasound guidance with a 22 modifier for increased services. So anytime you have a situation where the provider's having to take additional time other than what is normally considered regular, you're gonna, as long as the provider is documenting what they did, and essentially, like I said, I'm just kind of showing you these things to kind of get your mind to like, oh, okay, well, this is alerting me because the provider literally says it's taking an increased amount of time and manipulation. Did I say increased? Increased amount of adipose tissue. Oops. So the increased amount of adipose tissue, which is, on a morbidly obese patient, it is going to be a little bit more difficult to get to that joint because they do have to be able to kind of move and to be able to get the needle to go in right into the joint where like it needs to go. So this is why whenever they say additional time, yes, additional time and manipulation was needed to locate the joint to perform the injection. This is not your straightforward injection. He's not going to just be able to numb or clean off the knee and then, do the injection. He's not going to be able to do that. He has to move and make sure that he's got the needle going into the right spot. So this is why, just to kind of get your mind to looking into what those additional modifiers mean. And don't worry, I am going to do one where I'm talking about all the modifiers and what they mean and what is common for those. But I wanted to get you guys to start thinking about that, okay? This is why I did it. So if you didn't get the 22 modifier, don't sweat it. This was just to kind of get your eyes to start opening when they start saying these things. When you're reading this documentation, oh, okay, well, he did additional things. Let me go ahead and make sure that he's, documenting everything like he should. And I'm going to go ahead and make sure that that 22 modifier gets on there for increased services. Okay. And I also got the RT for the right side that they injected. All right. Easy as pie, right? It's like I said, it's all about those details. But once you start getting into that habit of looking for details and knowing kind of like what those triggers are for certain things, it'll start to get easier. So try not to get overwhelmed. It'll get easier. So, but one other thing before we go on to the next one, that 20611, I love that code because it talks about the ultrasound guidance. Okay, you're not going to use a separate code for that. It's just one code. Okay, so that 20611 covers the injection and the ultrasound guidance. Okay, so next one is epigastric hernia reducible, and they had a laparoscopic epigastric hernia repair. So the code is for the diagnosis for the epigastric hernia, I got K43.9, and for the procedure, I got 49652. Okay. And then for the last one, the diagnostic spinal cord tap, 62270. Okay. So how do you think you guys did? Did you do good? Did you have any questions? Let me know and comment below if you did. I'm always trying to look for those little challenging ones that's going to kind of help you guys to start learning those little tricks that, you know, veteran coders look for. You know, those are the things that at least I know that I try to spot. Okay. I will be working on injuries this week because I think that injuries is some of the things that most coders have a lot of problems with, and or at least a lot of the coders that I know have problems with that, but that's okay. Let's talk about it so that we can learn it, okay? All right, so moving on to what happened today. So I completely geeked out today on one of my providers, and I say geeked out because I completely geeked out. So last week, right, this provider, okay, let me rewind first. The way that we have our workload set up is we have our clinics, okay, and I have multiple clinics, okay, so this means I have multiple providers. The amount of providers I have is a lot, okay, so I have to make sure that I'm managing my time well, and I got to make sure that I'm making sure that I touch everybody in a timely manner, right? Touch all of their encounters in a timely manner. So there's one particular provider that I'm not going to say his name because this particular provider, I've mentioned him before, and as far as like he's proving why he is going to get MVP. So every year I do the Coder Awards, right? So what I do is I take a look at the provider and how well they've been doing. If they do best documentation, what I consider to be best documentation, then they get the best documentation award. If they get a lot of their injury codes right, you know, they get best injury coding, you know, things like that. So this year, and I have a few other ones that I did. I just can't think of them off the top of my head. But this particular provider, he got best injury coding last year. So he's getting MVP this year because he's proving time and time again that he deserves it. I mean, he literally deserves MVP. So I try to, when I consider who is going to be MVP for the clinic, I look at everything that they do. How many times do I have to query them? And even if I do have to query them a lot, it doesn't necessarily take them out of the running for MVP. With this particular provider, I can see that he's applying himself. He is really trying. He's making sure that whenever I do send out an email, I can see the improvements that he's been making. I can see that he's trying to listen, or he's asking questions like, am I doing this right? Or what else do I need to know about this particular documentation that if I'm doing it right or wrong. So when I see people like that, that's what puts in my mind, this person is MVP. Okay. So last year's MVP would probably be this year's MVP again, but he can't get it twice. That's a rule that I made. Okay. You can't get it twice, and you've got it once, let somebody else have it. So this particular provider that's going to get it this year, he is extremely deserving of it. And like last week when I was working on stuff, I happened to be working on it on Friday afternoon. I was like, man, he's doing like really good. He's hitting all his bullets, he's hitting his points. And I'm like, okay, you know what I mean? Like, good job. And I have to keep, like last week, I had to keep bumping his levels up because he was coding himself too low. I was like, okay, well, you know, he did this, so his E&M level is going to go up. So I said, okay. And then I had to do very few changes to his diagnosis selection, because sometimes they'll select a diagnosis code that's like unspecified or something. But he was like pretty much on the money on his diagnosis selections too. And I was like, oh my gosh, this is freaking amazing. So today, when I go in this morning, right? So I'm setting up everything, I'm eating my turkey sandwich, and I'm all good to go. And so I said, well, let me go ahead and finish him up. So I go back into his stuff, and I don't have that much more left to go because I knocked a lot of it out on Friday. Okay. So I'm working, and I say, he's doing pretty good. And I'm savoring this because I'm really enjoying the fact that I can look at his documentation, I can look at his code selections and think, he's got it. He's got it. I don't have to really change a whole lot. So I'm like, yes, and I'm hitting a good groove, and I'm just knocking him out. Then all of a sudden I open up an encounter and I see that he's applied a 22 modifier. And I go, okay. He's applied this 22 modifier. Did he do it right? So then I open the encounter up, and I'm reading this encounter. And I was like so overwhelmed. I was like, oh my gosh. And I'm in my office and I'm freaking out. I'm just like completely geeked out. And I'm like, okay. I was like, just calm down, Blue. You can't run over there. It is Monday. You can't just go over there and jump up and down in glee. You have to calm down. So I'm like, oh my gosh. So I'm like, this is so freaking cool. This is what I like. This is what I need to see. When I see things like this, it just makes me so happy. This literally makes my day. But it gets better. So, sequela is one of those things that in injury coding, you either get it or you don't get it. Okay? And sometimes, like, it takes some people a few times to catch it. So this was another encounter. So I kept going, and I was like, okay, this is really cool. I'm going to have to tell him later that this is really awesome. So then I open up this next encounter, and I see that he has coded the manifestation of this sequela injury and the sequela. And I was like, oh my gosh. So literally, like, I couldn't help myself. So then I'm pulling up my email, and I'm like, oh my gosh, sir. And I'm like, you totally just made my day. And I was like, yes, I am completely geeked out. I said, this is really awesome. Your documentation is phenomenal. I mean, I don't normally just tell them this stuff to just blow up their ego. This was literally legit. I was like, I was beside myself. And I even told him, I was like, sir, I am beside myself. Thank you so much for everything that you do, for all of your wonderful documentation. And I was just like, thank you. I'm just so happy. So he saw me later, and he was laughing. He was like, really? He's like, well, I'm glad, you know. And I'm like, okay, so don't let your ego, you know. And he goes, oh no, of course not. Of course not. So, but it was really awesome to see that. That literally made my day. And then, so I got, we got a lot of rain, and it's messing with my allergies. I'm trying not to sneeze. Okay, it passed. So I got my audits back. I got one error. Now, I could have taken this one error and just been like, whatever, you know what I mean? You found something. Okay, whatever. But then when I looked at what the error was, I was like, And it was for abnormal findings. But I guess my boss didn't really like the wordage on it. But when I printed out all of those things, I was like, I totally have my argument. It's right here, you know. So I went online and I printed out some stuff that supports the use of that code. And then I pulled out my coder desk reference that literally says it supports this code, you know. So it's just like, so tomorrow I have to probably go see her the day after, but I'm very excited. You know why? Because this means that across the board in my diagnosis coding, my procedure coding, my modifiers, and my E&M levels, all 4 categories would be 100%. And see, this is what I was mentioning the last time I was talking about audits, is when you have those months, and this just happens to be that month. I know it is, because I'm going to be able to get that one error back, you know, and I'll be 100% in all 4 categories. So I'm very excited about that, you know, because, you know, this just goes to show that when I'm looking at all this stuff, and I can take on a high volume of encounters and still be able to come out on top. So I'm very glad. This was very awesome. Today was a totally awesome day. But so I know I always tell you guys I'm going to do Stitch Fix unboxing. So my Stitch Fix came in, and of course I ripped open the box because I'm thinking, oh yeah, you know, I could just set it up and then I can show and then everything's cool. I think this is my last month for Stitch Fix, because like they put me with another stylist, and the other stylist, I'd had her for a couple of times, and it was just, I mean, my first stylist, the first time I got Stitch Fixed, she was freaking awesome. I mean, like, Taylor really loves clothes, you could tell, you know, and so it was like I had her a couple times, and then after that it was this other lady, and I'm like, are you freaking kidding me? Like, really? And then she got one box that was like totally okay, you know, and then everything else was just like, I don't know. Like, are you even looking at my dimensions? I mean, seriously, you know. And so this last one, the one I got today, it was like, no, boo, no, I don't think so. And this is like a completely new stylist to me, and she's like, oh yes, you know, I see that, you know, you like red and things like that. Yes, I do. I love red, you know, but one of the dresses that she sent was a dress that I got last month, but a little bit longer. So I was just like, no, because that dress didn't fit me. This dress sure as heck doesn't fit me. And then the other blouses, I'm like, I'm not spending $88 for a blouse. Not doing it, you know. And then the other ones, it was just like, I would, no. There's no way I'm wearing that. I'm very particular about the clothes that I wear, because I like to be able to project myself in a particular way, which is very well dressed, and I know how to dress myself. You know what I mean? That's how I like to look. I like to be professional. I do not like going into an office and seeing people just be like, whatever, you know, I'm just here and I'm in jeans or whatever. If you're in a professional environment, I always recommend that you dress up, that you at least wear a polo. If you're gonna wear a t-shirt, at least wear a polo, you know. But for me, I like to be well dressed. I like to wear dresses. I like to look nice. I like to be professional at all times. You know, I do not like just looking like I'm just thrown together. I don't like that look. So, but that's just me. But like I said, importance in being professional in a professional environment is very important. So I'm just saying. So, oh, and then I'm gonna go ahead and wrap this one up because it's getting long and I'm getting long-winded. But somebody did ask me if what do I do with my old books? Do I throw them away when I get new ones? No, I don't. Because I am a book lover. I just happen to not have the older versions, because what I do is I pass them along. If I have a copy of the current year book and then I get my new books, either I'll keep it for a little while, and then if somebody else needs it, then I'll just pass it along. But I never throw away books, especially coding books, because number one, coding books are very expensive. I'm fortunate enough at my employer gives me my books every year, you know, and it's great because, you know, at least I can have it and reference it and take it with me whenever I am working with providers. But when it comes to just throwing away books, no, I don't do that. I will always either keep it or I will pass it along to somebody else who needs it. You know, that's just what I do, because it's such a waste to see people throw away books, and it's just like, it would drive me crazy whenever I would see it, and it's just like, really, like, why are you doing that? Like, somebody else could use that book, you know. And I've rescued a few books, you know, from the recycle bin, because I was just like, no, somebody else can use these. So what I would do is I would keep them in my office with me. So if ever somebody needed it, whatever, they would come in and get it, whatever they needed. Or, you know, if somebody else was looking or needed it, or if there was a nurse that needed to look at a code or whatever, you know, they could just keep it at the nurse's station or whatever. And I mean, that's just what I do, because like I said, I mean, these books are way too valuable, you know. And then sometimes you do have to go back and look at the reason that you selected a code at that time. And, you know, of course, if you have the new books, you wouldn't be able to understand your reasoning for selecting a particular code if you had gotten an audit on a previous year record. So, yep. So that was my Monday. So all the answers. So let me know if you guys did good, which I'm sure you did. Let me know if you have any questions. If you are wanting a particular specialty, let me know, so that way when I do Quiz Friday, it'll be all ready. So I will see y'all here tomorrow for Q&A Tuesday. If you have any questions, there's still time to submit questions for Q&A Tuesday, so let me know. And I will see y'all tomorrow. I hope y'all have a great evening. So if you are a medical coder, a medical coding student, somebody curious about the fascinating world of medical coding, a provider or a nurse, I hope you will like and subscribe and follow me on my channel and my journey in medical coding. All right, I will see y'all tomorrow. Bye.